Why therapy isn't always effective, understanding the reasons and exploring alternative options. Therapy can be a transformative experience for many people, helping them to overcome mental health challenges, process difficult experiences, and improve their overall well-being. However, therapy isn't always a straightforward process, and some individuals may find that it doesn't work as well for them as they had hoped. This can be frustrating and discouraging, but it's important to understand that therapy not working doesn't necessarily mean that it's a dead end. In this article, we'll explore some of the reasons why therapy may not work for some people, and what steps you can take if you find yourself in this situation. Why therapy may not work for everyone. Mismatched therapist-client relationship. One of the most common reasons why therapy may not work for someone is a mismatch between the therapist and client. A good therapeutic relationship is key to the success of therapy, and if the client doesn't feel understood, validated, or comfortable with the therapist, progress may be difficult to achieve. This can be due to differences in communication styles, personality clashes, or a lack of shared values or goals. Unresolved trauma. Individuals who have experienced trauma in their lives may find it particularly difficult to make progress in therapy. Trauma can leave deep emotional scars that take time and specialized therapeutic approaches to heal. If a therapist isn't trained in trauma-informed therapy, they may not be equipped to effectively treat trauma-related symptoms. Lack of active engagement. Therapy is a collaborative process, and the client's active engagement is crucial to its success. If the client is not invested in the therapy process, fails to attend sessions regularly, or is resistant to exploring difficult emotions or behaviors, progress may be slow or non-existent. Unhealthy coping mechanisms. Some individuals may have developed unhealthy coping mechanisms as a way to deal with their emotional distress, such as substance use or self-harm. If these behaviors are not addressed in therapy, progress may be hindered. Misdiagnosis or inaccurate treatment plan. If a client is misdiagnosed or if the treatment plan is not tailored to their specific needs, therapy may not be effective. For example, a client with bipolar disorder may not benefit from traditional talk therapy alone, and may require medication management in addition to therapy. What to do if therapy isn't working? Communicate with your therapist. If you're feeling stuck or frustrated with therapy, it's important to communicate this with your therapist. They may be able to adjust the therapeutic approach or treatment plan to better meet your needs, or provide additional resources or referrals to other therapists who may be better suited to your situation. Explore alternative therapeutic approaches. There are many different types of therapy available, and what works for one person may not work for another. If traditional talk therapy isn't working for you, it may be worth exploring other approaches, such as cognitive, behavioral therapy, art therapy, or mindfulness-based therapy. Seek a second opinion. If you're feeling unsure about your diagnosis or treatment plan, seeking a second opinion from another mental health professional can be helpful. This can provide you with additional insight and options for treatment. Address other contributing factors. Therapy is just one aspect of mental health treatment, and addressing other contributing factors, such as medication management or lifestyle changes, can also be important. Discussing these factors with your therapist and medical provider can help to improve overall treatment outcomes. Practice self-care. Finally, it's important to practice self-care and prioritize your overall well-being, even if therapy isn't working as you had hoped. This can include engaging in activities you enjoy. Consider a different therapeutic approach. If you've been in therapy for a while and haven't seen any improvement, it may be time to consider a different therapeutic approach. There are many different types of therapy, and some may work better for you than others. Talk to your therapist about alternative approaches, such as cognitive, behavioral therapy, psychodynamic therapy, or group therapy. Seek support from other sources. While therapy is a valuable tool in addressing mental health issues, it's not the only source of support available. Consider seeking support from other sources, such as friends, family, or support groups. These sources can offer a different perspective and provide additional emotional support. Take care of yourself. Regardless of whether therapy is working or not, it's important to take care of yourself. This includes getting enough sleep, eating well, and exercising regularly. Engage in activities that bring you joy and help you relax, such as reading a book, taking a bath, or practicing yoga. Remember that taking care of yourself is essential for your overall well-being. Be patient. Therapy is a journey, and progress can take time. While it can be frustrating when therapy doesn't seem to be working, it's important to be patient and continue to work with your therapist. Sometimes progress may not be immediately apparent, but over time, you may begin to notice positive changes in your thoughts and behaviors. Know when to seek alternative treatment. In some cases, therapy may not be the best treatment option for your mental health issues. If you've tried therapy for an extended period of time and haven't seen any improvement, it may be time to consider alternative treatment options, such as medication or alternative therapies like acupuncture or meditation. In conclusion, therapy is an important tool for addressing mental health issues, but it's not always effective for everyone. If you're feeling stuck in therapy, it's important to speak up and work with your therapist to address any barriers to progress. It's also important to seek support from other sources, take care of yourself, and be patient. Remember, there are many treatment options available, and with persistence and patience, you can find the right approach to help you overcome your mental health challenges.